nice and tight. This is going to be one of those easy things that just slips right through.
No, exactly. And that's why we wanted to talk about this. But no, I appreciate everybody joining in today. I see there's still a few joining in, but we'll go ahead and get started. Welcome to today's webinar session. My name is Ray Walters. I'm going to be your host for today's session, joined by my co-host, Mr. Jose Delgado. Just a brief background. If you're listening for the first time, Jose has 20 years plus experience in healthcare consulting. Currently owns a owns and operates a mental health clinic. Has a ton of experience. Today's topic of discussion, we're going to be discussing
Yeah,
OSHA.
Shelly, where you been? Sorry to interrupt you, Ray, but
Welcome back, Shelley. It has been a while. I'm happy to see you back on the episode. But today's topic, we're going to be discussing OSHA Hep B mandates, and yeah, let's sort of dive into it. Go Bucks!
go Bucks, another Florida person. Nice, nice.
And yeah, let's go ahead and dive into it. And
So I'm gonna assume that everybody knows what OSHA is because if you've been watching anything that we do here, it is one that we don't normally touch that much. But it is one that is important, and depending on your environment, it could be vastly important, right? Like there's a lot of little details that can trip you up just because things you can ask, things you can't ask, how you can influence or how you cannot influence. So we want to make sure that, we're not getting into trouble. Obviously, I'm going to keep it very, very simple. If you don't have clear policies and procedures, get them. To write them all up, yes, you can do it. Yes, you can go through OSHA and figure out what applies to healthcare, what applies to construction, what applies to manufacturing, what applies to teaching. The OSHA, I don't know if anybody's looked at the OSHA regs, but they don't split it by industry. So,
it's
you'd have
generalized.
to parse through it. And that's just OSHA, not to mention all of the other things. So, if you do not have a vendor or a way to get your policies and procedures, you should get one. Obviously, we're going to always recommend Epi Compliance here because this is the Epi Compliance podcast. Now, in full transparency, there are other vendors, and I would actually go and say, hey, talk to the other vendors, talk to Ray, and put them side by side. See and I'm pretty confident on where you'll go. Um, but
I appreciate that,
outside of
Jose.
that, let's jump right into it. Ray, do you want to show them how it works in the system, or how do you want to play with this?
Well, I wanted to showcase that towards the end,
Okay.
because as you mentioned, we're coming up. One of our processes through Epi Compliance is managing your OSHA and Hep B for your employees and staff, and keeping track of that data is important, right? And mapping that out. And we have a new feature that we're going to be releasing on Thursday this week, that's going to allow organizations, and again, this stuff applies to any level size organization, but think about those hospital level systems that got 200 plus employees. Um, we have a process now keeping track of this data, and essentially employees will be logging in and attesting to these things. And, did you get your Hep B vaccination? Yes or no? And we're sort of
Are
tracking
you
that
going
information.
to?
Or are you going to? Um, did you decline it, et cetera? We're tracking all those data points, and it generates a nice report. And but again, to Jose's point, this is something that is required of every business, to have in place, have those policies, procedures in place. That's another thing that Epi Compliance provides. But like I said, Jose, I'd like to show that towards the end,
So
if
yeah, yeah.
possible.
So
But we,
let's talk about it a little bit, right? Hep B, for those that don't know, we're referring to hepatitis B, right? The mandate is if someone wants the vaccine, you've got to provide it. if they don't want it, you've got to document that they don't want it, not just a verbal no, but you need to document it. Right. So this is where epi compliance comes into play because they can help you document the ones that got it, document the ones that didn't get it. Obviously, you're not allowed to discriminate one way or the other. The reason why somebody says no, irrelevant. You know what I mean? Like it's just
Mhm.
a simple yes or a no. The one of the popular questions I get is when do we ask the question? Because this isn't the only thing that we have to ask those yes or no questions. Obviously, anybody that's been in the industry since COVID knows that that COVID vaccine was a yes or a no, but really it was a if you want to keep your job, it's a yes. So there have been and there will be other situations like Hep B, like COVID. So you want to make sure that you're aware of where your policies and procedures are, so that way you can modify them as you need them for any eventualities that come up, right? Um, so outside of that,
I
I
was going to
mean,
say,
it is
Jose,
good.
there was another. So I just shared just a point of reference. This is straight from OSHA.gov site. It's a fact sheet. One point, we've mentioned this in previous webinars as far as training is concerned, how, any new hire has to complete OSHA training within a 10-day period. Same thing sort of applies to this as well. As far as the employer is concerned, you must make the vaccination available to employees within 10 working days of initial assignment. So kind of an across the board thing that I've read. So very important to know. Um, and also, Jose, as far as employee declining the vaccination, employers must ensure that they sign a declination form as well, which is
Mhm.
something I would say might, could be missed, right? In terms of keeping track of these things.
That one, in my experience, is the one that tends to get missed because you're just like, okay, they declined it, bye. You know what I mean? Like, you're not documenting it because nothing is getting done. But you need to document that if for no other reason than CYA, because if they were to contract it, for whatever reason at your work, and the surveyors will ask for it. You're absolutely correct, Shelly. And I was gonna say too, if you've never done or never been a part of an OSHA inspection, it is one of two things: either quick and painless, and you'll probably never see them again, or it's gonna hurt and you're gonna see them every bloody year. So make sure that you're ready, make sure that you've got everything and it's nice, clean, and simple. But definitely the declinations are just as important, if not more so, than the log with those that got it. Again, if you're not asking about this on your onboarding day, I would highly recommend adding it to. And I know that it's a lot of stuff that you want to add into your onboarding between all of the other compliance training and then the payrolls and the benefits and the this and the that and then the shadowing and then the HR training and then depending on the size of the organization you probably have standardized HR training and sexual harassment training and this training and that training, but this is just one simple piece of paper. Just add it with your payroll pieces and just punch it, get it done. So that way the employee would just you'll know that it got done day one. So
And that's kind
what
of
else
what
you
it
got?
comes down to with epi compliance is, our customers, when they add their staff member, they are essentially, and again, it's more so of a suggestion, right? Because when we recommend to our customers, that have practices, have their staff members log in and taking the training. Any new hires, that's your first step with us. Add them onto the system, their first assignment, take the OSHA training. And then now, as I mentioned, we're coming out with a new feature with the Hep B stuff. They can attest to these things immediately through our platform, which is great. Um, I was going to
So
say to your point about the declination as well. If you get into a scenario where, an employee, maybe they come back and later they request, yeah, actually, I want to do it. They can change that status on our system. But as far as the place of employment, you have to make that available. Um, if it's not. And then is there any costs associated with this, Jose?
Uh, well, with Epi compliance, yes.
No, not
With
the Epi compliance. I'm saying if somebody is requesting a Hep B shot as an employer,
um,
do you
it's
provide
not
it
very
at no cost?
expensive. I know that, but I don't think it's very expensive. But my office, honestly, we don't even deal with needles, so everybody declines it in my office.
I think it has to be provided at no cost, if I'm not mistaken,
Yeah,
but I could be
no
wrong.
cost to the pay to the employee, but I'm saying to the employer. I
Yeah,
want to say it's cheap, but I haven't had to go through it in quite some time, so I don't know. I don't know if anything's changed on that. Um, by no means is it, it cost prohibitive, but I would imagine it's a nominal fee just because of storage and shipping and all that fun stuff.
of
It's not
course.
something you pick up at your Walgreens, or Eckerd's or CVS. Eckerd's, God, just aged myself. I don't even know if anybody remembers Eckerd's drugstores.
I'm getting flashbacks. My mother used to work there when I was a kid, man.
Oh
Uh,
man. So yeah,
yeah.
so this is a very, very simple process. Like I said, if you don't have a process for it, yeah, we send them to local labs. Yeah. Yeah, so yeah, Shelly, you're right. Um, so when it comes to making sure that it gets done, who is your OSHA officer? If you don't have an OSHA officer, or if your one person is everything, I would highly recommend that you get like an RN. Yeah, see, Paulette, you're saying it's 120 to 340. So, for a small office, that can hurt a little bit just on the front end, but it's not a big deal because you can just get it done quickly and get it and just be done with it because it's just cost of doing business. Uh, but as I was saying, if you don't have an OSHA officer, I always recommend nurse managers because they're going to be on the floor, they're going to be seeing when people, and they're going to be closer to the action when people actually hurt themselves, because remember what OSHA is for. OSHA is for preventing workplace injuries, let's be honest, and employee safety. So normally you see a lot of OSHA issues in regards to the sharps in healthcare. Oh, I got stuck. Well, did you get the Hep B vaccine? That's usually where the second question follows up, right? Were you following the protocols when you were attempting to stick the patient and not yourself? So I don't want to jump into a lot of the different subtopics, but yeah. So there you go, Paula. Yeah. So it's usually 3 doses, but some people may need more. So
Actually, didn't know that.
I didn't remember that
Learned
piece, I'll
something
be
new.
honest with you.
Learned something new.
Yep, there you go. So, but realistically, what we want to do either way is either have we want to have the list of declinations or the list of yes, let's get it done. Then you want to get it done just as quickly as possible so that way you can get them in the field. Because that's why you hired that employee, not to be just sitting on the bench doing nothing. So, Ray, let's show them.
Yeah,
Let's show them how the form is.
give me just a second. So we have some. I'm gonna be share screening here in just a second, but I'm sharing some images because again, Jose, as I mentioned, this goes live on Thursday, so there's still being a couple tweaks here and there.
Well, I mean, so it's a draft, everybody.
It's
Don't
a
don't make fun of
draft.
Ray too much.
Oh
But
my
it gives
goodness.
you the basic concepts, ease of use, and how it can be stored here. So,
Give me
um,
just a second. I'm just gonna get the Hep B actual form pulled up here. Should have had this earlier.
Shelly,
Forgive me.
Shelly, quit calling us out like that. All right, like we're not old, we're seasoned. Okay, um, no, don't do that, Shelly, because then you calling me old too, just by association. I can't do that. I can't. I'm not gonna Danny Glover this from Lethal Weapon, I'm too old for this ish. Can't be doing it. Can't be doing it.
So let me go ahead and put this here.
Oh,
And
Ray
again,
wasn't ready. Ray wasn't ready.
no, Ray is ready. Hold on. Sharing her now. We'll just roll with it. Let me know when you guys can see. Jose, give me a heads
We
up.
are, yep, we're there.
Cool. Oh no, I can't. Hold on. I'm gonna see if I can. I'm gonna unshare and drag over. Sorry. I don't know why I can't do that here in this view.
There we go.
This isn't what I wanted to show though. Well, this is the original process, right? So this was the original EPI compliance process when tracking these hepatitis B. So essentially, this form is fillable within our platform. But as the OSHA compliance officer, you have to go in here and sort of individually type everybody out and document the dates, their employee ID number, et cetera. You can see how cumbersome that is.
But if you're new school, it's PDF fillable, and if you're old school,
It
you can
is.
download and print it. So it's not that big. It's not that big of a deal.
It's not a huge deal. And hang on, I'm gonna get these for whatever reason I couldn't drag these images over, so I'm gonna
But
stop sharing real
then
quick.
he's gonna show us the new.
I'm gonna show you the new. At least the just the draft of it. Like I said, we're going live with this on Thursday, but I just want to give just a fresh perspective on this process.
I'm sure this is gonna be like the seat warmers. You didn't know you wanted it until you got it, and you're like, "Holy cow, this is massive."
Well, I love this because this is listen, it's feedback that we've received from customers is how we got to this point. But
There you go.
are you able to see this here, Jose?
Yes.
So
Yes.
this is sort of, and again, just trying to paint a picture at this point, but you can see at the top right, oops, I didn't mean to do that. Top right where it says status shared, vaccination pending, et cetera. It says yes, no. So again, employees will be able to log in and essentially attest to these things, and it sort of auto-populates onto that old school document that I had showed you earlier, but a little more beefed up. And then as far as the reporting mechanism I mentioned, you can download it. Our customers can download a status report. So you can see on the left-hand side here, this is going to list out all of your employees and where they
Yep.
currently stand with the vaccination. Have they attested to this or not? So again, the idea is to sort of map this data out so that you can just generate this report in an instant. So, um,
When we print it, are we gonna have to pull the tabs on the side like the perforating paper from
no,
like
no.
Shelly was talking about?
No, just go portrait mode on it. It'll fit. It'll fit. You don't have to do that. But obviously you can save that report, on the personal computer. If you wanted to print it, yes, you certainly can. But like I said, we're tracking these things a little more closely, if you will. And above all, it's making the compliance officer's job a little easier than having to go in there and sort of fill things out line by line. And this is sort of tracking those things real time for our users. So stay tuned though, because at the end of the day, when we release this live, if you are an EPI compliance customer, you will be receiving some correspondence soon to schedule workshops. So we are going to do sort of an open meeting to discuss these new features and these processes, and just stay tuned for that. There will be some registration links. I think these workshops are going to be sometime next week and the week after. So just stay tuned.
So then, Ray,
But
on this report, I'm seeing that it's saying the organization been provided documentation the status of your vaccination. So this would be if I haven't logged in before because I'm a horrible employee or I'm sidetracked or whatever the case may be, then the answer is going to be no, or is that going
we'll
to be
go
a
with the
blank
latter.
there? Huh?
So yeah, so it says has your organization been provided documentation status of your hepatitis B vaccination? When the employee logs in, that status will change.
Okay.
Um, and then over there where it says what is the status of your Hep B vaccination, when
Yep.
they attest, that'll essentially you can see one of the test users say completed full vaccination, etc. If they decline it, you'll see sort of a decline
Yep.
status as well. So again, keeping track of all those points.
Are you able to upload the said documents there if a surveyor wanted to see the signed form? So Shelley, correct me if I'm wrong, but you're asking on that individual attestation of the employee, not just this report.
I
Is
believe it's
that it?
broken.
That yeah.
I believe it's broke. So when the user attests, it will create sort of an individual attestation document for that. And that will be stored in the user's personal folder that the OSHA officers will have access to. So the
Got
answer
it.
is yes.
Okay. So yeah, so then yes, Shelly, you could upload it or it'll be saved on there automatically for you when they attest to it. So this is, I mean, now you just have to make sure 3 times that they check that they just log in. One, because you want them to do their initial training for OSHA, OIG, HIPAA privacy and security. Two, to get this done, and then three, so they know where the policies and procedures are, right?
It's
So I
funny because
mean,
we're slowly just adding more and more things for the staff to attest to, right? It's like the HIPAA confidentiality and security agreement. That's one of the that well, that's been a process, but obviously, anytime a staff member logs in for the first time, that's one of the first documents that'll pull up that they can e-sign. As a HIPAA confidentiality and security agreement. Every employee within the organization has to sign that. So, like I said, we make it as far essentially the onboarding process, right?
yeah.
Just like this is going to be. When they log in, this is going to be one of those tasks that they have to complete or at least attest to. Um,
So if I'm in the field in the mix, bringing on a new employee, again, I want to make sure that my life is as easy as possible for that HR manager and for that new employee, that new hires immediate supervisor. So make sure you've got a nice clean matrix of who is doing what when, so that way there isn't anything mixed, especially if it's something easy like this, you know. Um, it's not worth the trouble. And those of you that have gone through it know exactly what we're talking about. So make sure your HR process is nice and easy. For smaller practices, honestly, it's relatively easy because most offices don't offer benefits. So it's, it's kind of lean, right? Because you don't normally have the compliance part, the pay part, the benefits part, and then the on-the-job training. But if you don't have the benefits part, then there you go. On the job training is there faster. So just make sure that all of those people are aware of what they need to do and how they need to do it. If you're a small practice and you're having to do everything yourself, get yourself a checklist because it's the only way you're going to get through everything on top of
mm,
everything else. It's just the only way to do it. If you're a multi-department situation, you want a checklist for each person and then one person to make sure that all of it is done. So whether
absolutely.
that is your overall compliance officer, whether that is the supervisor of the individual, that's up to your organizations to kind of figure out that piece. But more and more, I'm seeing if you're going to get fined from the federal government, it's because of something you didn't do with an employee or something you weren't supposed to do with a patient, or a
Yeah.
patient died. So, so let's focus on those because those are going to be the hit items that we're seeing from the federal government that they're queuing up. It's just, and if you haven't seen the dashboard lately, this is what the dashboard looks like, everybody.
Yeah, this is the main dashboard logging in as the compliance officer. So, again, the compliance officer is going to have all the access to the bells and whistles. When the staff member is logging in, really their primary responsibility, other than attesting to those things that we had mentioned, is the training. And we make it
It's this
simple.
header.
Essentially, yes. And you can see where it says enrolled courses, right? And again, we've probably mentioned this on almost every webinar, but it is a 10-day require. It's 10 days or less that any new hire has to complete the OSHA training within 10-day period. Again, our service offers not just OSHA, but HIPAA privacy, HIPAA security, and Medicare CMS compliance. So essentially, we're offering 4 courses for the staff member to complete. Technically, yes, they just have to complete the OSHA within that 10-day period, but I always suggest to our customers just have
Yeah,
them do it
HIP is
all.
30, so you might as well just get it all done
Have them do
all
it
in one
all.
go.
Um, all the user logs in, can access the course here at a point of a click, and then you take a lecture, voiceover slideshow presentation. Once you conclude the lecture, you're able to take the test, and then once you complete the test with a passing score, of course, we don't make it that simple. Passing score is 7 out of 10 or better. If you don't pass the first time, no, not the end of the world. You just retake
You're an
it.
office manager, though, you are able to see if someone's initiated the
Yes.
class or initiated the test, done with the tech class, done with the test. So it's broken down into two
Yep.
sections, which is nice for me because I can actually see, oh, yeah, I'm working on it.
Nope.
Bobby, you're at the same spot you were a week ago. What are we doing? Let's get it done, right? So it allows for, mm,
Hold
eh,
people accountable. That's what it is.
huh?
Hold people accountable.
Yeah.
And it's a good vetting process. If you hire somebody and you give them 10 days to complete the training, they don't do it. Well, maybe you don't want Bobby working for
Yeah,
you.
maybe this is your 2 week notice,
Exactly.
You got 4 more
But to
days.
to Jose's point, you can see, we call this training reports. And again, this is a feature that compliance officers have access to, where they can essentially survey all of their uh, active employees and where they stand with these trainings. Even boil down to how many attempts it took them. If if you really wanted to get on somebody's case, wait, you didn't pass the first time? I see you took 3 attempts.
I mean,
So,
Shelly, you're not wrong, but again, I'm not going to go and judge how somebody gets the job done as long as they get it done, right? Like as a consultant, skin that cat however you need to, but it's got to get skinned. So,
it's a good
yeah,
point.
it's the easiest way to do it is right at the start, but this is for those, remember, because a lot of these trainings you got to do annually as well. So it's following up with the
Yep.
old employees along with the new ones. Depending on how your turnover is at your organization, you
We
could
do
be
make
looking.
that simpler too, Jose. But keep going. Sorry.
No, no, you could be ended up looking at a page like this weekly just to see, all right, it's Susie's annual. She's going to ask me for a raise, but I'm not even going to talk to her about a raise until this is done. So I mean, you got a couple different ways to get this to make sure and confirm that it's all done, which
Yeah.
is crucial. And then it also gives
I,
you a list so that way if you do get audited, you can easily show, hey, this is what's going on here. Um, yeah,
definitely ticks.
I mean, Shelly, I never want to know if an employee paid their kid to do the job.
That's too funny.
Um, I will say that are there courses that I have seen that you could just click through, take the test, and be done with it? I have seen it. It's honestly a matter of it's just you're just checking a box for the federal government. But if the employee botches something that was covered in the class, it's me as a manager can now hold you as an employee accountable because you can't say you didn't know that. The I didn't know I wasn't supposed to do that, Ossifer, ain't go fly here because you were told it, it's on your policies and procedures, you were trained on it as part of your annual training, and you still found a way to screw this up. Boo boo, timeout.
I was gonna say, I see the most of the time what I see is the staff member will log in and actually take the doctor's training for them because they don't have to. I see that more than anything.
We're not going to talk
But
about how
I'm not gonna
providers are
go.
the worst aspects of
Yeah.
compliance ever. We're not going to do it because
Give-
everyone knows it. It's a reality of compliance. I mean, even auditors know it that the providers are the worst. I mean,
Yeah, that's
so
that's
we're not going to.
essentially the customer service I deal with is a practice manager calling up and, hey, I'm trying to get the doctor to take the course, but he won't do it. What do I do? Should I take it for him? I'm like, no, he's got to take it.
So I'm going to say this because I don't have a license for something like this, so it's fine, right? So when it comes to trainings like these, and you know that your provider is not going to do it, it is highly recommended that your provider gets this done. How it gets done is normally not the question that is asked, it's the question of, is it done?
Yeah.
Right? So it's very clear. Only answer the question that is being asked.
Yeah.
Is
Do
that
you have a
name on the
certificate?
list of people that have completed the training?
Yep.
You don't ask questions you don't want the answers to. Okay. Like that, it's that simple. I'm not condoning, I'm not recommending, I'm merely saying only answer the questions that you need to answer. So,
Don't put
as
yourself in
long as
that
it's,
situation.
huh?
Say less.
Yes, yes. If you
Less is
don't
better.
catch what I'm saying, then don't catch what I'm saying.
Yeah.
So,
But to
yeah.
your point earlier, Jose, about obviously, if you're working in a big health system that's, over 200 plus employees and you're managing everybody's training, that could be a pain. We try to make it simple. Obviously, taking the course on our program, once you complete the lecture, you complete the test, you get a certificate issued. It's a downloadable PDF. On that date of completion, that certificate is valid for 12 months. 30
Now, if
days.
you switch organizations, it does not matter. They can
Yeah.
still be an Epi compliance customer because I hear this crap all the time from new employees and office managers. Just let me know if I'm wrong. I just did my training last month with my old employer. Do I have to do it again? Bobby, shut up.
Yeah.
Go do the training. I don't
Yeah. Get
care.
that a lot.
I don't care. Oh, I even did it on a. I don't care. That's awesome. Then you know what the answers are. Just get it done. You know what I mean? Like, go back to your desk, get it done. So it's absolutely critical that
Do
we
get
that we
that.
make sure.
Yeah. Do
Nothing,
get
yeah,
that.
exactly.
Agree.
Nothing transfers. You know, nothing for compliance transfers. If it's
No.
credits, it transfers within state easily. Out of state depends on your license. I'm not going to get into that because every licensing board is different, every medical board is different. It's just not it's better for you to check what your local rules are. But when it comes to compliance, nothing transfers. Yeah,
Yeah.
yeah. So if you're going to be in healthcare, assume that every time you switch organizations, you got to do all of this training all over again, and every year you got to do it too. So if
Yep.
anything, if you don't like doing the training, find one spot and stay there. You know, it
Well,
helps everyone, I
you're
promise.
at least saving yourself from taking it twice, right?
I mean, you're helping everyone
Or three times.
involved
Who
when
knows?
you can stay in one place for a significant period of time. You're helping the team out because you're a known quantity. You're helping yourself out because you don't have to do the onboarding training every single time you switch place. You know, you don't have to switch payroll companies. You don't have to do this. There's a lot of stuff you don't have to worry about, right? So find a spot, stay there, and that way this stuff just rides out nice and easy.
It makes the compliance officer's life a little easier too.
Oh, between yeah, HR, the
HR, compliance
compliance,
office,
yeah,
all
so
the
all that
above,
fun
really.
stuff.
But
All that fun stuff. So yeah, so I mean, realistically, that's pretty much what we've got. This is a nice cut and dry. We stretched it out a little bit just to kind of show you guys the system some. If you got any questions, please throw them in the chat. What do we got next week, Ray?
it's a good question. It's open-ended right now.
It's open ended. I thought we had a few.
Oh, well, we were supposed to chat. There were some things that I was there at the MGMA conference. There was a lot of talk about AI and workforce retention, things like that. I just, you know, I don't know. What's the group? What's the group?
So
Does
I
the
did.
group want to chat
Go
or
ahead.
want us to talk about any topics? Maybe
I
Shelly's got
did come
something.
across an article about an 81-year-old man, Medicare, traditional Medicare, that was billed like $20,000 for a hospital stay in actually the Tampa St. Pete area. So
Mm.
it was something that I was looking to dive into just because I wanted to see how that happened to the patient. Even though we're normally on the provider side of things, there has to have been something wonky there in order for the patient to be responsible. Because it's just an odd case. Again, it's that time of year, 19K for a rehab stay. Yeah, so I mean, we can go over something like that. We can go over, I mean, there's all kinds of stuff that we could possibly go over. Yeah, the only thing they had they after he was there after a knee replacement, and the only thing that was adjusted was $83 from Medicare.
Wow.
Like,
Where
what
do
in
you
the
find these
world?
things?
It's supposed to be the other way around. The patient should pay the $83 and Medicare pay the $20,000 bill. Um, I mean, yeah, so we can go over all kinds of situations there.
I was
Uh
at
yeah,
the
Paulette, we'll see you next week. Keep an eye out for our correspondence. We'll definitely have something popping. We'll definitely have something popping up for next week and the week after that. It's spring break. I feel like we should do something fun.
spring cleaning.
Spring
Man,
cleaning.
I gotta do that in real
Well,
life.
I mean, we could do spring cleaning as in, hey, this is how you go through the system and check. This is something that we're reviewing and updating. This is something that we're customizing versus the default policies and procedures. We can do something like that. That's a little bit
Yeah,
more hands-on. Everybody can see the system if they haven't been playing with the system.
could do
If
that.
you're potential customers of Epi Compliance, if you're current customers of Epi Compliance, that would be a nice little quick tutorial.
You
Um,
know, another topic, Jose. Well, I like your topic. We can look to discuss that next week. But I guess a takeaway from that MGMA conference, there was a lot of operational leaders, whether, CEOs, admins, ambulatory managers for these large healthcare organizations. Surprisingly, a lot of them rely heavily on spreadsheets still. Kind of crazy
absolutely.
for like their roster
Absolutely.
management, onboarding, etc.
Absolutely.
Um, so that was interesting.
I thought you were going to say something
There's
interesting
some,
that I actually spoke to your partner in crime that went to Vegas with you. He
yeah,
was telling me the amount of burnout on the
uh,
admin side was he was shocked and
yeah,
slightly
yeah.
appalled by the amount
No,
of like public burnout that everyone was talking openly about. Hey, I'll switch companies. You think there's anything better? Like it's
we
kind
had
of
several
impressive.
conversations with some attendees there that again are in operational positions, and they just flat out said, I'm over it," and they've been in the
Yeah.
industry for 10 plus years, and
Oh, I mean, so Tracy, you're the reason why I say it is because you're not the only one, right? As much as everyone says, "Hey, the providers are burning out," the providers are burning out. What about the admin executive team? You're not getting any more resources, which is why everyone is using Excel because most companies are using Windows, which means you've got Microsoft Office on there, right? Or it's very cheap and easy to get.
Mhm.
We don't generate revenue, so we're not getting resources, right? And as the organizations grow and as private equities come in and as insurance companies buy practices, you're starting to see even in the larger specialty offices that if it doesn't help the bottom line, they don't want to spend the money. Just flat out. In smaller
Right.
offices, they want to spend the money, they want to help you, but they just can't because they don't have the money. In the larger organizations, they have the money, but they don't see the point in it because I can dump $3,000 to make admin's life easier, or I can buy some brand new surgery equipment. Or I can buy, like something to help the revenue generators generate more revenue, or a new toy for the partners. So it's absolutely something that we see on a regular basis, but it's also why the healthcare industry needed the carrot and the stick of meaningful use to
Hmm.
even move into the electronic and 21st century. If not, I firmly believe we would still be on paper. We would
No, you're
still be on
right.
paper if we weren't forced to e-prescribe and we weren't forced into meaningful use. It's absolutely wild. Absolutely wild. Shelly, you're not the only one. I have multiple spreadsheets for the mental health practice. I have a revenue one, I have a patient tracker one that also tracks the referral sources. I mean, I've got an AR one that also tracks P&L. I'm right there with you. I mean, it's just easier that way, right? So when you're a larger organization, you're just focused on the one piece. Procurements are always doing Excel documents. So, but we can go into a couple different things. Um,
Yeah, no,
well,
absolutely.
so like I said, be on the lookout then, everybody. Ray and I will chat and and you'll know from
Yeah,
the minute we go.
everybody's gonna get we'll get this up on a YouTube hopefully by this afternoon, if not early tomorrow. And then there will
As
be
long as it's recording, Ray, right?
it's recording, my friend. It's recording. The red dot is up at the top. Yeah. Shelly, you weren't here the other, or well, I don't know if Tracy
Two
was
weeks
on that
ago.
either. But a couple weeks ago, we had a interview with Dr. Delgado, and mind you, that was like what 64 episodes in. We've been doing these since October of
Yep.
2023. I don't know what happened, but that meeting didn't get recorded. So after the fact, I'm sitting here digging through Zoom looking for this file, and it's not there. I'm like, what the heck just happened? So Jose and I had to do a recap later in the week and re-record it, just us. So yeah, that was fun. But but hey, listen, we learned our lesson, and
Yep.
yeah, every
Yep,
time
Shelly,
I
we need to do an audit and see why
yeah,
see
somebody
why
needs
why this
policy
happened
review.
so that way it doesn't happen again.
I need to go back to my SOP and
Yeah,
adjust.
yeah.
Make sure the recording is checked.
Yeah, yeah. I mean, I honestly think it was just user error. You know what I mean? Like I was able to do it just
Human
fine.
element, yeah, human element, human error.
That human element,
All
it's
right.
gonna happen. It's not a matter of if, but when. So now we got to figure out what the
It's like the
punishment's
work
gonna be.
what is it, the workplace injury sign. It's been this many days since yeah, we're resetting that clock over here.
Tracy, I know you come for the entertainment. I mean, we're just here to make you feel better. It isn't just you, it's everybody.
Yeah.
Right?
We got to make this fun. We got to make this
Yeah,
fun.
exactly, exactly. So perfect. So then everybody keep an eye out. I know that we got some interesting stuff coming up for end of Q2, beginning of Q3,
Yep.
between the CHSOs. So if that's something you're interested in as well, you're gonna get some correspondence about that. And then yeah, if you've got any questions, concerns, please feel free to reach out to either one or both of us, and we'll help you out in any way that we can.
Absolutely. I appreciate everybody joining in. We'll see you next week. And Jose, I appreciate you joining in with us today.
Hey, yeah, as always, take it easy, guys. Stay out of trouble.
You too, Jose.